So again, when we opened the chest, we first saw the natural alignment of the heart, lungs, the great vessels. As we took the lungs out, we found that the left lung has two lobes to it. Here's the oblique fissure on the left side. It had this marked cardiac indentation, and the lingula, this little tongue coming out. Again, this little lingula wanted to be a middle lobe, but it's like the little choo-choo jet wanted. That was a little story when I was growing up. I couldn't climb up the hill. Anyway, so then the left lung just has those two lobes. Inside the lungs are the bronchopulmonary segments, and this one's pretty good actually, because it shows the bronchopulmonary segments are defined by the pulmonary arteries. I'm sorry. See, that's where they have it wrong. I remember. The pulmonary arteries should have blue.
Yeah.
I knew this was wrong. Pulmonary arteries are deoxygenated blood coming from the heart. So the pulmonary arteries run with the bronchi and distribute along with the bronchi. The pulmonary veins run separately, sort of like this shows, between the segments of the lung. So again, how many segments of the lung? Anybody remember?
On
right
the left
lung?
or the right?
Right lung?
The right, there's 10.
10, and the left?
8.
8, right, because it wanted to be 10, but again, the heart kept it from becoming 10. And again, this is the cardiac indentation, a fairly marked indentation in the lung. Okay, so bronchopulmonary segments, again, defined by the pulmonary artery and the bronchi. The veins are independent. The pulmonary arteries carry deoxygenated blood, the pulmonary veins carry oxygenated blood. The same is true for the right lung, except that there are 3 lobes to the right lung. Okay, so there are 3 lobes, superior, medial, inferior. And what is this fissure called?
Transverse.
Transverse. This is the
Oblique.
oblique. So the other side has the oblique, it just doesn't, again, have the transverse. Now it has some indentations, they don't show them here, mainly for the esophagus. Okay, so when we take out the lungs, then we see the middle mediastinum, the superior mediastinum. The anterior mediastinum we opened, it was right behind the sternum. It was that fatty tissue. Again, in a child, the thymus would extend down into that area, but as an adult, there's just some fatty tissue. That was the first thing when we lifted up the sternum off of the chest. Middle mediastinum is the heart. Superior mediastinum is primarily the great vessels. Also, the trachea is in the superior mediastinum. So those are the main structures. The structure being the
Superior
vena
vena cava.
cava, inferior vena cava. These are the hepatic veins, 3 of them. We'll learn that in a few short weeks. Aorta, pulmonary artery. Again, the pulmonary artery comes out anterior to the aorta, but quickly the aorta, as it twists, I think that model may show it a little better, but they change place.
So you said these are the pulmonary arteries here, or wouldn't that be the pulmonary vein since this is the artery coming off?
Yes, but see, and then it's wrong. Because again, the pulmonary arteries are not running in the interstitium, they're running with the bronchi.
Okay.
The person just didn't quite understand it. He should have painted these blue and these red. Okay? I don't want to confuse you.
So what's
the
running with it?
bronchopulmonary segments, bronchus, pulmonary artery. Just remember that.
Broncho.
Vein is independent, it's running in this interstitium between the segments.
Okay.
Okay. I'm not going to use these, but it's a good model to just go over, except for that confusing. Thank you for pointing that out, because, again, that was the error. The anterior part of the heart is the, what chamber?
Right.
Right ventricle, correct. right ventricle and right atrium. Of course, the right auricle. This sort of cone here, going up to the pulmonary artery, is the conus arteriosus. And it's, again, sort of a funnel. The heart has, the interior of the heart especially, has the sort of like the crista terminalis and a number of the structures, architecturally or engineering, they funnel the blood in a certain pathway to help it go along the line. And certainly the conus arteriosus helps with that. As far as coronary arteries, that short segment is the, right there.
The short segment?
Yeah. What is that? Which coronary artery?
Oh, right.
Look where it's going.
The left.
Left, okay?
Oh.
So the left coronary artery is very short.
Mm-hmm.
We got a little glimpse of it. Unfortunately, our cadaver, I mean, we could spend hours and hours and hours dissecting, but that's not going to help you. If you do want to come back and dissect, fine. Anyway, the left coronary artery is very short, maybe a centimeter or two.
Okay.
It arises from behind which cusp? The aortic valve. Left artery arises from the coronary sinus, the left coronary sinus.
Okay.
3 coronary sinuses in the aortic valve. Those little things behind the cusps. Left, right, and
Posterior.
posterior, because it's posterior. Remember the aorta when it comes off and this is called the base of the heart, right in this area. So when the aorta comes off, it is posterior. Good. Immediately, the left coronary artery divides into the left anterior descending. In the books, it will say left intraventricular, because that is where the ventricular septum is. When we go inside, it'll be right there. So either one of those, the LAD or the left interventricular coronary artery. It gives off branches. These are the diagonal, sometimes they call it obtuse. Let's just use the word diagonal because they sort of look like that.
Okay.
Okay?
So those are just diagonal arteries, or?
Those are branches of the left coronary artery,
Okay.
mainly going to the left ventricle, some going over towards the right ventricle. Again, this is the left anterior descending, the left interventricular. There is one larger branch that comes down, and that's called the marginal branch. And this is sort of the margin of the heart. So that's going to be the marginal. The right coronary is going to have a marginal artery too. We'll see in a second. And then the last part of the left coronary is the circumflex coronary artery. And that, again, arises where it comes off the left, main left coronary artery is variable, but it arises and it goes around the back of the heart. So it's a very, very significant. Remember the ventricle, our pump, it goes to our brain, it goes to our lungs, our kidneys and liver and everything else is the left ventricle. So it's very important. Again, left atrium, right atrium, auricle. The right coronary artery arises from, of course, the right coronary sulcus, which is behind the right cusp, right, left, posterior. It then travels just underneath the atrium, around the back. It gives off a branch. The first branch, of course, is the atrial branch. It goes to the sinoatrial node, so it's a very, very important branch. It also has obtuse types of arteries, and it also has a marginal artery, this last one. So whichever is the last one going right along the edge, that's the marginal artery, okay? Now if we take the heart out, superior vena cava, the pulmonary arteries. If we take the heart out, we look around the back, the right coronary comes between, just underneath the left atrium, and it sends off a very major branch in the right in the posterior interventricular artery. There's LAD, left anterior descending, but there's no similar thing for the right. So call them the interventricular. Those grooves are the interventricular between the ventricles. So right coronary artery comes around, again, the marginal, the interventricular, very major branch, supplies a lot of the left ventricle. The left circumflex is coming around, giving off again those marginal arteries, and they sort of come together. So this area, if someone has a blockage of the left coronary artery, hopefully, you'll see in pathology, they will develop collaterals that would suffice. Now again, you learn pathology, most myocardial infarctions occur not on something of a chronic basis, but because of an acute event, and again, you'll learn that pathology, a rupture of the plaque of the material in the atherosclerosis. So again, those are the posterior. I'm not going to test you on the veins, except this is the what vein?
The circumflex?
No.
Or the coronary?
Coronary, right.
Sinus.
The coronary veins and the coronary sinus. It is the main vein draining all of the blood back to the heart. It goes to the right atrium, so there are 3 holes in the right atrium, superior, inferior vena cava, and the coronary vein.
So it's actually a coronary vein, and not is it, or is it coronary sinus?
People will refer to it as a coronary sinus as well.
Okay, so either
one's going to be okay.
acceptable. Okay.
And that very definitely separates the atria from the ventricles. That's the atrioventricular groove right across there. So it's more defined posteriorly than truthfully anteriorly because of the atria themselves. We talked inferior vena cava. What are these 4 things?
Which one's the pulmonary?
Yeah. Pulmonary vein.
Pulmonary veins, right? Correct. There's 2 pulmonary veins coming out from each lung. Remember that? We'll look at them in the review. And this is the pulmonary artery, and there's a right and there's a left. There's just one pulmonary artery to each lung. Now they do, of course, got branches, but at the level of the superior mediastinum, there, this is what we're seeing. Okay?
So of the arteries and veins, you said the only one you would ask is the coronary sinus. Is that
Of
what
the
you were-
veins.
Of the veins. Okay.
Correct.
Okay.
I guess I should test you on the great cardiac vein up front and the I can't remember, lesser, middle. Anyway, the coronary sinus is what I want you to remember. The muscles in the ventricle are called
Papillary?
Which
Papillary.
one?
Oh.
Which
well, the
muscles?
papillary muscles are in there.
There's pectinate,
We're
there's...
going to look all that up. The muscles in the atria are the pectinate. These are the, I even forgot.
Trabecular.
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 Chordae trabeculate. Those are the muscles. But you're right, the papillary muscles are also in there. Sorry, I had a brain fart. So in the atria, remember the posterior wall is very, very smooth in both atria. The anterior wall, especially the auricle, have the pectinate muscles in them. You can see here the outflow tract, the pulmonary outflow tract. Again, this is the right side of the heart. So this is pulmonary outflow, conus arteriosus. Now the aorta has an outflow tract as well.
Outflow tract?
Outflow.
Outflow.
Outflow. Okay.
Yeah. Means blood going
Yeah. Okay.
and so again, this is the conus arteriosus. The left ventricle has an outflow tract, and it doesn't have any name other than left ventricular outflow tract.
Okay.
So that's it. Again, the atria, the auricles, we've seen all that. Posterior wall of the atria are very smooth. This little thing is to represent what?
Which
What is the
I'm
shunt
sorry.
between the atria?
What were you pointing at?
It goes between the atria. Here's the other opening. Left atrium, right, and
Oh,
the
that's...
baby.
Oh, yeah, the oh my gosh,
Fossa Vallis.
fossa vallis, yeah.
This is oval, look at it, it's oval, Fossa Vallis, okay? Comes a Fremont Valley when it closes up. Where's the coronary thing coming in? I take that back. Again, I don't use these models very much. That is the exit of the blood from the coronary sinus, excuse me. That's blue here, because it's deoxygenated, I don't know why they painted it that color. This is the Fremont Valley.
Okay.
This dent
So the
there,
little
right?
circle.
That's
The,
the,
Yeah.
yeah.
Okay, yeah.
Okay? So the coronary sinus goes in, has a eustachian valve. The inferior vena cava has a valve, that little thing they're trying to show, which is the Thebesian valve. Okay? The superior vena cava doesn't have any because the blood is going with gravity. These are to keep the blood from backing up in our legs, our liver, and our small intestine, etc. So the interventricular septum, right ventricle, the myocardium, right ventricular wall, left ventricular wall.
I'm sorry.
Again, the papillary muscles, they're not done very well. How many leaflets are there in the tricuspid valve? I just told you.
3.
3, okay.
I was like, is
In
that
the,
a trick
in the
question?
mitral valve,
2?
Two.
who's buried in Grant's tomb? Okay. Okay, so there are 3 and 2. The papillary muscles are defined the same. On the right, there's the anterior, and there's the other 2 leaflets on the right. What goes along with anterior? If I say anterior, what do you say?
Posterior.
Posterior. So there's a right anterior, there's right posterior, and the other one is against the septum. So there's 3 leaflets, right, left, the posterior, anterior, posterior, and the septal.
Okay.
Those
and
are the
and that's-
3 leaflets.
And that's underneath the tricuspid?
That's the tricuspid valve.
Okay.
Now, this does not show it very well, a little circle of paper is not. The muscles there's going to be 3 muscles, 3 papillary muscles, right, anterior, and septal. The chorda tendineae, these little parachute strings, they don't go just to one valve leaflet. If you think about a tent holding it open, it's got to, stretch to, a couple, at least 2.
Okay.
Okay? It doesn't show it here, but there's we're looking hard, a little ridge called a crista terminalis. And do you remember what's in the crista terminalis?
The SA node.
SA node, correct.
Good job.
SA node is right where the superior vena cava meets the right atrium. So right in there, there's that crista terminalis. The heart shows it better, this doesn't show it. Pulmonary valve, 3 leaflets, what are they? What position?
It's anterior
Anterior,
and right and left.
right and left. Okay?
That's what I was
And they're called semilunar valves because they look like half of a moon. On the other side of the valves, we can't see, but are the coronary sinuses. We can't see in there. The coronary sinus is a little hollow area. The aortic valve and pulmonary valve, this is the pulmonary valve, open into those sinuses. So again, there's a flap, a semilunar flap, and it opens into those sinuses, open and closes. As we get older, calcification of the aortic valve especially, and it is due purely to that opening and closing 4 million times a day.
4 million.
Or something. There's some number. I just did it in pathology. But the opening and closing of the aortic valve is a huge number. So that, in time, is going to sort of traumatize that valve. We can't change the valves. We can change the valves. But eventually. So people will get senile because of old age, not because of mentality. Senile calcified aortic stenosis. We'll talk about that in the path. But just to point it out. So the aortic valve has a anterior, a right, and a left.
I thought it was posterior.
Yeah, because if the other one's
Yeah,
I'm
yeah.
sorry, posterior, thank you. Posterior, a left, and a right. Sorry, thank you for, I'm sort of looking at it backwards. Mitral valve has two leaflets, anterior, posterior, again, two papillary muscles, anterior, posterior, again, chorda tendinate, parachute strings, stringers to the tent, and they go to both of the leaflets from there. Left atrium, again, has the four pulmonary veins. Okay. I think, well, this may show it a little better. It's still just a circle, but certainly this is the anterior papillary muscle. This is the septum, the septal papillary muscle, and here's the posterior. Remember, it had a hard time seeing that posterior. It's sort of, and especially in cadavers, plastered back there. Again, the pulmonary artery, mitral valve with an anterior and a posterior leaflet. Again, the names of the papillary muscles. Here's the no, not really. The crista terminalis goes right this way. To the right atrium, this has a really deep fossa valis. That's the coronary sinus. Sorry, it gets my attention and everybody else.
What is that? Is that Geronimo?
like the old western.
Hello. Hey, Dylan. I'm in the pathology department.
I don't know what it is. Is it me or does he talk us a little slow? He talks a little, I mean, you know, that's the thing, it's hard for me. So he's not gonna use the models? For the heart, but not the. Okay.
Yeah, I know.
Class. Happening.
I laughed about it. He wanted.
My whole life I wanted to dissect a cadaver, and it's really cool and everything, but it's not as fun as I thought it would be.
Really?
Like in my brain, like I had it all like, ramped up. It was so fun, and
It was exciting at the beginning.
It was.
But I mean, I'm
It's still-
excited to get into GI stuff. Like,
Oh, yeah, I think that's,
Really looks like, so just pictures.
yeah.
because I mean, just the way that they always have like the small
Just
intestines
like
like
this,
perfectly.
yeah.
Like it's gonna be kind of cool to see that.
oh,
Stuff.
the intestines. I didn't think about that.
Yeah.
The stomach and all that stuff.
Pull it
like-
out, it's all connected.
One of my favorite words to say is duodium. I think it's a good day. It's a good day. A good word.
I can learn Mr. Piper. He'll say duodenum one day,
Yeah.
and then he'll say duodenum the next day.
Yeah.
Yeah, he's bipolar just in
Which
general.
one is it?
Yeah.
Like he's,
Duodenum.
Oh gosh,
he could be
I
cool,
was
but
trying to
then he
listen to
could
his
be mean.
lectures last night. I was,
Good luck with that.
Torture.
If I try to go, that'd be like the review would be more helpful for me to point out what's more important.
okay.
You know what
Just
I'll
go
do?
through the
I'll
slides
send it
and
to you. I'll send it to you so you can go over it and
Yeah.
like kind of note it, and then
Yeah, that'll help.
because I'm typing out all the notes or for myself, so that way when we sit down tomorrow.
Yeah, I don't remember like what does what and all that stuff because I was going over it and like the first exam stuff.
Yeah.
It's like impossible to remember because he'll put like dehydrate square rate just so that's it.
Yeah.
And what he's trying to say is like that's the more absorbed form or something like that. I don't remember. Yeah, but I can remember like what's important.
So again, finishing, tricuspid, left atrium, the pulmonary veins, pulmonary artery, aorta. Let's see if they got this right. Pulmonary artery runs with the bronchi, and the pulmonary veins are separate. Well, they sort of show them together. And this is the way that, well, here's a little better, that they do run together. But I'm going to use again our lungs that you all dissected. You did a great job. So the heart is the middle mediastinum. Superior mediastinum is the great vessels, all of that. Of course, there's nerves, and other structures in there. How many plexi are there? 3. Cardiac, esophageal, and what's the other main structures in the chest? Pulmonary. Okay, so those are 3. The cardiac and the pulmonary lie right anterior to the bifurcation of the trachea. So,
Both of them do?
yeah, they're right in that area. The cardiac's probably more anterior, pulmonary back, but those plexi are right in that area. The plexus, obviously, on the esophagus is running up and down the esophagus. What nerve is that that's making that plexus on the esophagus? Primarily? Vagus, right, correct. There is sympathetic in there, but mostly we're seeing the vagus nerve. That's what I'll be testing you. So the bronchi, left main stem, right main stem. On the left side, superior lobe, inferior lobe, superior lobe, and then the inferior lobe branches to the middle and again the inferior lobe. The bronchopulmonary, the lymph nodes in the lung, again, don't look at this is terrible. The lymph nodes in the lung, there are pulmonary lymph nodes present in the lung. Remember the lymphatic drainage just under the parietal pleura drains out, sort of a circle, goes down. Most of the blood lymphatic goes directly to the, what is this called with these vessels and bronchi? The what of the lung? Hilum,
Hiatus?
root.
Oh, the hilum.
Oh,
Hilum or root?
With the encasing around it?
No, the encasing's
Oh,
gone.
just that, then the root.
Yeah, the root, right. What we're looking at is the root of the lung. The pleura is gone. Inferior pulmonary ligament, left bigger than the right.
Which one's the ligament?
The brown or the white?
Well, the white is encasing the brown.
Okay.
okay, so
It's
the
the
brown
pleura.
is
The whole
ligament?
structure is the inferior pulmonary
Okay.
ligament. A whole structure. Esophagus, remember, it comes down and is mostly in the right of the aorta, but then as it goes through the diaphragm, it goes anterior and even slightly left of the aorta. So again, with cancers, we have to go through the right chest if we're resecting this part. So going back to lymph nodes. So they are pulmonary, just inside there. Bronchopulmonary are present, as you would imagine, right along these major bronchi. We've seen a bunch of those black nodes. Right at the bifurcation, we'll see more. Okay. Up along the trachea, what are those lymph nodes called?
Tracheal, bronchial.
Paratracheal.
Paratracheal? Paratracheal
Paratracheal.
lymph nodes.
Okay, so those are the nodes going up here. Now they're all draining into what structure behind we're going to see today, hopefully?
The thoracic duct.
Left, yeah, the thoracic duct, which goes primarily into the left. It goes into the left right here where this 90-degree angle is between the subclavian vein, the brachiocephalic, and the internal jugular vein. Now there is one, again, on the right, but for us in the class, the left. We'll talk about the left. That is behind all of these structures. The esophagus in descending order, descending aorta, what part of the mediastinum are they in? Is four parts. Posterior. So there's posterior, anterior, superior, middle. Right. Okay. Middle heart, anterior, posterior, those structures, and superior, these, and the trachea is part of that. The trachea is part of the superior, not the posterior mediastinum. I think we've covered everything. Have I not covered anything? Oh, the vagus nerve. broken heart syndrome, Takotsubo syndrome. That's a little hint to whet your appetite, so you're take pathology too. Okay, the vagus nerve. Oh well. The vagus nerve, oh, let me steal this, comes down from its nucleus, okay?
Okay.
It runs into what?
Carotid
Sheath, carotid sheath, okay? So it starts anterior, it starts descending, it gives off a branch, the recurrent laryngeal nerve, right around, right around the aorta, the brachiocephalic, I'm sorry, around the left subclavian,
I think what does aorta, the right?
the aortic arch. It comes off of the aortic arch. Thank you. We're going to have him do the test.
Yeah.
Okay, aortic arch. The right comes down and goes under the subclavian artery, the recurrent laryngeal nerves.
But it's
So
not
it goes
actually
in-
on there, is it? The
No,
Vegas?
no,
Oh,
no, no,
okay,
no.
okay.
But we saw him in the cadaver. We'll look at it again. Okay? So, and the sympathetic chains are our posterior. So let's start. What I'd like you to do, it's up to you, however you want to do it. It's a little hard for 4 people to dissect the mediastinum. I think 2 people ought to start working